There's been several patients that I've engaged with over the years, and I've been doing this since probably 2015 on a regular basis, that has showed me the true meaning of determination, the true meaning of resilience, the incredible capacity that one individual has to endure just almost unbearable conditions.
One of the biggest myths is that people experiencing homelessness do not want to get better. It's happening in our community, it happens in our families, it happens to friends. The mobile medical team specifically has been in development mostly over the past 10 years after I met Lindsay Fox. Lindsay and I felt passionate about changing the delivery of care to patients who were not able to access medical care in our traditional system.
There's a lot of areas of need. It strikes me every time we're out there, we are seeing women who've suffered from violence. We recently have seen a large number of folks who've had a stroke. So to me, the challenge is sort of seeing folks that are so sick and are suffering in so many ways is really hard. To be able to meet them where they're at, try to offer sort of immediate and real-time help and services, help out in any way that we can, feels really good.
It has influenced me a lot. It has shown me that there is humanity, but it does give an outside look to what we can offer and how we can change people's lives just by the little things that we're able to provide them.
As I've spent more time with the team, having conversations with the folks that we meet, taking vitals, kind of assisting with some of the hands-on tasks that there are in a day is a way that students can be involved.
Our team has 2 vehicles which were generously donated by Mrs. and Dr. Burns. And our team is able to take learners along with themselves and all the supplies where people can access care.
If you have a heart for the homeless and you love the state of New Mexico, this is a wonderful program to be involved in.
Yeah. It seems to me it's a huge shift from going to expecting people to show up where healthcare is to bringing healthcare to where somebody is who really doesn't have the means to access traditional healthcare. That's a huge shift in thinking.
We want to see it more robust and a bigger program, and to do that, they need sustainable funding to help hire more staff. To do this at UNM, they need sustainable funds, and we want to encourage anybody who has a heart for the homeless to become part of this program, because great things are going to happen.
You know, I'd say part of the vision for the future is not only expanding the care that's in Albuquerque, but, to see other communities take on something similar to this. People who are unhoused are everywhere.
We've had tremendous support from generous donations that include the purchase of our vehicles, but the ongoing sustainability always is a challenge to be able to be sure we have enough to pay for salaries, to provide student experiences, for supplies, even something as basic as body wipes and socks and gauze pads. It's a careful balancing act that we are all learning how to manage and can always use support.
Fortunately, with a generous donation from Mrs. and Dr. Burns, our team is able to go out and meet patients where they are. So I urge everyone to take a step back and to bring humanity back into our world, and to continue to see that health equity is extremely important to our humanity.